Here we are taking off the tissue healing cap. It's been in there for about 3 or 4 months. How nice the tissue is healed. Okay. Impression coping, please. Do you see the site now? Put it back on. Okay, you see it pretty well. Putting on the impression coping. This is a Zimmer regular platform. It's all the way tight. We're going to go ahead and verify that it's seated completely with an X-ray. Checking the fit of the tray. This is a stock tray. Can be also done with a custom tray. And we'll check it in the mouth. And it's fitting real well. Taking our impression there right now. This is a closed impression system. Open. Great. I'm going to let that set for 4 minutes. We got it. A lot of good detail. So now we have our impressions. We have our counter model. Okay, and now we're going to take a bite. Put the tissue healing cap back on. Okay, bite again. I'll take the bite now. Okay. And bite down. Close. All the way. Hold that. Okay, then we'll take this off. You can take your shade. Take a shade with it on, actually. Okay, what else?
That's it. Nice and simple.
Simple. Okay. Okay, so, and then we have the bite. We have the impression. Counter. Simple. This is the second appointment for our Simpl restoration. Laboratory has done their work. We are ready to proceed. We're going to remove the tissue healing cap. We are now going to use the Atlantis fixture with the Duralay jig to help seat it properly. Watch how we place it in the mouth. We use the jig to rest it on the adjacent tooth. The tooth is indicated on the buccal number 5. It fits right into place. We can now just tighten manually all the way down. We take it off. We see that the abutment is anatomically correct. This one is made out of titanium. We're going to check to see how it's fitting. And it looks like it's in the right position. Also, we can notice that number 5 is marked in the buccal. But this abutment can only fit one way. One, because it's anatomically correct, it follows the soft tissue margins. We are now going to try the crown. In. And we're pushing the crown in. The contact field may be a little snug. We're going to check that with floss. Okay. And we get the floss in with some resistance. And now we're going to check the occlusion. And bite down, close, open, bite down, open, bite down, open. Let's check the bite. The patient is not anesthetized at all during the procedure. We'll see, how does the bite feel? Does it feel like it feels hitting good, or does it feel a little high? Now, at this point, if the restoration doesn't seem like it's seating, we have the option of taking an x-ray to make sure it's seated in place before we take a final, before we cement it finally. So why don't we go ahead and take an x-ray? So the crown appears to be fitting very well. I'm just going to touch the occlusion a little bit before we cement it in. So slightly. And then we'll check a final check after the cement sets. Now we are going to now torque the abutment in. Torque this down to the manufacturer's recommendation. And we're going to put a little cotton pellet in. Sometimes we use cotton pellets, sometimes we'll use some Cavet G just on the axis opening so that cement doesn't get all the way in. And now we're going to choose to cement the crown with Duralon and a little Vaseline. And that way it's on there pretty secure, yet we have the ability to remove the crown in case something may happen. The screw loosens up a little bit. If it was an all-ceramic crown, most likely we'd cement this in with a resin cement. Okay. And bite down all the way, close. Great. Open. And bite down. And we'll let that seat for about 2 minutes till the cement sets. We got nice snug contacts around the implant, so we don't have any cement. Scaler, please. And we can see how nice the margins are and how perfect and the shade match. Everything looks great. And I'm going to take everything off now. Check the occlusion one more time. And bite down, tap, tap, tap. Open. Give me a piece of paper, please. Give me a paper. We'll do that one more time. So the whole insert should take you really no more than 15 minutes. Simple. Okay, we're all done. How's it feel? Not too bad, the procedure, right? Not numb? Go ahead and choose something. The girls will give them some post-op instructions about implant placement. And we'll probably do a follow-up appointment in a few weeks.